It's been almost 50 years since the Surgeon General of the United States ordered tobacco companies to put health warning labels on their cigarette packages. And still, more than 20% of the population, more than 60 million Americans, continue to smoke. The result, more than 400,000 Americans, about the equivalent to the population of Miami, Florida, die of smoking-related deaths every year, joining the estimated 25 million people who have lost their lives since labeling was implemented. Do smokers seemingly have a death wish, or can they just not break the habit?
For years, we've underestimated the potency of nicotine and the addictive nature of nicotine. We've called smoking a bad habit. The Vietnam experience in America killed 55,000 GIs in all of Vietnam. We consider that a national tragedy. Nicotine dependence kills 400 to 450,000 Americans every year, and we consider that a bad habit. Physicians, medical treatment programs, addiction treatment programs, and mental health providers need to wake up and approach nicotine dependence as the disaster from a medical health standpoint and a patient safety standpoint that it is.
Dr. Ted Perrin of the Addiction Pros has spent more than 20 years specializing in addiction medicine and recovery. The nationally renowned physician lectures frequently on new trends in addiction treatment at forums across the country. He says it doesn't take much to become addicted to cigarettes.
Nicotine is a very powerful psychoactive drug that is highly addictive. If a person averages 3 cigarettes a day over about a month period of time, they've got an 80% chance of moving on to a pack or 2 packs a day for 20 or 30 years.
The addiction specialist says that 3 things can happen from prolonged smoking, and 2 of them are bad.
1 out of 3 smokers will die early because of the smoking. They'll die years before they should have because of the smoking. Another 1 out of 3 smokers will develop a medical disease which impairs their ability to function in life in and day out activities because of smoking. And about 1 out of 3 smokers seems to escape unscathed from nicotine dependence.
Dr. Perrin says smoking is like a ticking time bomb when it comes to a smoker's life. Ultimately, it's like a slow suicide.
Each cigarette on average takes about 7 minutes off of a person's life. So each minute spent actually actively smoking a cigarette decreases a person's life expectancy on average by that same amount of time. The reason why people smoke is because they are physically dependent to nicotine. And when the nicotine isn't in their system anymore, they go through substantial withdrawal from the nicotine, and they have strong cravings to continue to smoke.
There's a misconception that nicotine is a very dangerous drug.
Nicotine is a highly addictive drug. Nicotine keeps people smoking, but it's the actual smoke itself that kills people and that causes disease. So what we recommend to smokers is to stop smoking, even if they stay on nicotine through another form or another delivery system for a while they eventually get off of the nicotine.
The vast majority of people try to quit on their own, but unfortunately most need help, and it works.
If a person wants to quit smoking and they get counseling, they double their chance of success. If a person wants to quit smoking and they get counseling and some medication, they triple their chance of success. If a person wants to quit smoking and they get counseling, medication, and follow-up, they quadruple their chance of success.
Effective in 2012, the federal government is toughening its labeling stance by putting more aggressive graphics on cigarette labels. But, as in the past, it's likely that millions of Americans will continue to smoke and die as a result of smoking. The Addiction Pros are dedicated to eradicating smoking. They have created a powerful DVD training program for healthcare professionals and even consumers, which provides the tools for effective counseling and treatment, and it's available now.
Any and every healthcare professional should have the basic skills on how to counsel a smoker, on how to increase their odds of being able to successfully quit smoking. Physicians need to be involved, or mid-level practitioners if it's going to include the provision of medications.
Dr. Perrin says the Addiction Pros nicotine training program for staff development and continuing education does this.
Assists a healthcare individual or a healthcare treatment program to step back, educate themselves about the magnitude of the problem of nicotine dependence, begin a structured approach on how to most efficiently and effectively intervene with patients, and a system to be sure that that approach is used time after time after time with all patients they interact with.
For information on the program on nicotine addiction and treatment and a wide range of addiction problems, go to www.theaddictionpros.com.